In this module, I'm going to discuss how to create inpatient progress notes and what are the features of a inpatient progress note and related information around progress note. So let's go to a sample patient first. So I'm going into one of the patients here. So I'm going to this patient here and click go. Then we are going into the patient profile. In the patient profile, I'm going into one of the episodes, inpatient episodes, which has been already already created. So I'm going here, and let's say now this is your inpatient interface. You have summary there. So once you go to this particular drop down, you can see different functionalities in inpatient care. So in out of these, I'm going into progress note. This is how you can navigate into the progress note in inpatient. So basically, everything is here. As we go, it of course, I'll go into one by one modules there. So now in the progress node, you can see there are sort of a collection of a list of nodes are there, which you can sort according to the topic. You click here, in the top of uh, the the particular column. You can sort that particular section. Let's say if you want to get it according to the updated date or created date, you can click here. Then the most frequent entries will come in the top. Sorry, most recent entries will come in the top, and the rest will go to the bottom, uh, like this. Now, now 25th, this is the latest one. Likewise. So now this is sort of a repository for manually entered text notes or else template-based notes which can capture data. We call data form notes, or else there might be file uploads, which has image files, just documents like PDF files, or any external links. Yeah, on top of that, we have the functionalities such as using templates. It might be sort of just a text template, or else using templates, using a sort of a keyword while typing the note, things like that, which I'm going to discuss here. So first of all, let's go into the basic features of the progress note. So now let's say I'm going to put a note here. What I have to simply do, I have to press add note, and then put a topic for that. Let's say word round test one, something like that. Then I'm putting a word round note. This is test note, test word round note, something like that. Okay, now it's done. So once I've done it, save. So it's saved, and so it's saved, and you can see the note here, the note here in the top, and or so on. You can edit the note. Press edit note, save. So that's it. The note is edited. So now it's there. So likewise, you can simply play with that. So that's just sort of a simple basic note. But let's say you want to have a template for your note. So let's say now I'm in the same note, but I'm going to put a template there. So I'm going to do edit note, and I'm going to go to templates here. Now these are basically predefined templates, but you can set your own template as you want. Let's say now cough. So this shows sort of a template which you can use, or a soap template, something like this, or as word round, something like that. So once you take the template, once you click, select the same template, what you do, you can select either copy, replace the whole thing, or else copy to the top, or copy the bottom. You can select one of these. So I'm going to replace everything. So copy. So that would copy here and replacing everything there. Then you can fill the gaps, main issues of lethargy, normal tests, improving pneumonia, something like that. And so my templated based node is done. So something like that. So then that simply you can do that. The other option doing getting these templates. Now let's say if I'm going back again, I'm going back again to the same node, edit node, and then what I'm trying to do, I'm going to Control C and take this one out, but I'm going to take this using a typing command that I type here. So if I go to templates here, now you can see under the templates, you can see the same the template shows a shortcut key here. Now gen WR1 is this one, gen this one, the second one, gen WR2. So let's say now I want to get this template using this command. So gen WR2. So what I'm doing, let's say if I can remember that particular code, what I'm going to do, you can have a look here. Now it shows how it's done. Here, if you click this one, it says sharp and template name $sign. Then take your focus away from the text box. Then that would come. So that's like taking a template. But even you can do this for observations like vitals. The latest vitals will come if you put sharp obs vital and @ so similar, you can just try with this, like let's say sharp gen WR2. That's the one that we wanted, and then $sign. You can see automatically without going into the template pop-up, you can just copy the template here, straightforward. Just type in that particular code. So that's a simple way to how to get your templates here. And how to set your templates, how to set these templates, I will discuss in a different, about that. I'll discuss this one in a different video, right? So I'll save this. So this is how you can do your simple notes. And then notes also, there are file uploads like this. Let's say this is upload of ulcerated foot image. So I can view that one like this. Like this. This is the file. So simply what you can do, let's say if I want to upload a new file, new image or something. So what you have to do, you have to go here, file upload, and then you can select upload, and then you can select either what's this document, image, external links, internal, external links, and videos, voice recordings, all that can be uploaded. But I'm going to do image here, test img upload 1, something like this. I'll put let's take a sample image to upload. I'm going to one of the pictures. Let's say you want to upload something like this. So you can put any note here which should come as a note. Image test note. Note to the purpose. Something like that. So I'll put this one as sort of example. Send upload. Now this is uploaded, and this text is gone into your progress node there. So if I go back, now it's done. So if I go back now, you can see the image here and the image that we had there. So if I go back now, as our first one, that file is there, and that comes with this particular the entry that I did. And if I click open, then that would open into a pop-up box. So that's how you can simply put your files. You can upload your files. Basically, this is what we have here. And on top of that, there are more other features I'm going to discuss around progress nodes. The other important thing I would like to discuss here, how to have um, let's say once I'm doing a word round or day-to-day activity, if I have something really important, put it in the discharge summary at the end of the day, then we can select that bit and put it into the discharge summary. Let's say now I'll put this one now here, the word round. I say let me have this one, new complaint plan. Uh, Discharge to community further. This is just an example for the care in nutrition. Let's say patient has a nutrition issue now. That's the plan which comes from that particular uh, 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 encounter in the ward round. So let's say now this is what we have here, but I need to keep this for my documentation purposes later on, which I want to auto-populate into the discharge summary. So what I will do, now we can see add selected text to discharge summary here. So what I would do, I would select this, and then I click this one. One second. So I'm going to do copy this one, and Control C, and say this one, and then you can select here the Control V, then add. Now it has gone to episode summary note. Probably I discussed this episode summary note in a different module. So in here, if you go to this particular page, you can see episode summary notes. That's actually a summary note for the episode, which should be auto-populated into your discharge summary. So this here, where you say you have this what we selected, discharge the community for further care in nutrition. So then there are other things as well. You can directly put note here, and sometimes it comes from this one automatically comes from once you complete the tasks related to the problems. Likewise, so this is like a repository, like a list to go to the automated discharge summary once the patient is discharged from that episode. So more details around this will be covered in a different module. Right. So now we discuss about the basics features and how to upload files or images, and then how to have sort of related notes. So related notes are, let's say we are quoting a note while we are putting the note. Let's say now here um, we are putting something like this. In this note, let's say I'm putting a note saying as per as per attached as per attached image wound is healing. So now let's say now I'm putting an image file, but I'm quoting that image or uploaded file in this particular word down entry. So that's what I'm trying to do. I'm saving this one. Then I'm going into I'm after doing that one. Now what I'm going to do, I want to attach this particular foot, this one. I want to attach this foot ulcer, this one into that particular note, quote, that particular ulcer. So what I'm going to do, I'm going to, let's say, select this, and then go related notes, resources, like this. Then you can see there's a pop-up comes which has currently related notes. There's nothing here. But I'm going to add actually the foot ulcer here, this photo. So I'll add that one. Now you can see it has come to our list. So likewise, you can add multiple files, multiple nodes, and exit. Now, if I click this one again, now it has come to this particular box. So if you want to see that one, we can click, that directly comes there. So likewise, it's like summarizing the notes that we have. Sometimes, there are some notes that comes from different groups saying, according to the plan of physiotherapy, this is what we are going to do. So then you don't need to mention what the physiotherapy said in that particular, you just quote it. You can give a reference, like giving sort of internal reference to the notes that we have in the note list. That's a very handy tool because it helps with reduce the time to navigate through these progress notes. Likewise, we have a related discussion topics that we can do the same coding. So once I'm describing about the um, multidisciplinary meetings and multidisciplinary discussions. So we will discuss it more details. So it looks like we don't have anything to show that here. But anyway, we'll pick that. We'll discuss that one as we go ahead. So the other thing I would like to mention here. Now this is like not just a note, progress note, or correction of text. Um, but this has actually, it's like a repository for everything. Let's say now this particular procedure node, now you can see here, this has come from a different source. It's coming from a template, but it comes as a note here ultimately. So this is like, once you click this button, it takes you to the uh, original node, original or template that you have under this section. So now it has got the procedures. The procedure, this is what we have procedure node. So we'll discuss this in detail later, but for the time being, just to flag, this is like a repository for everything. Let's say now, even for admission notes, let's say now admission node, now you can see there's an admission node here. If I click that one, there's a detailed admission node. Actually, this is not typed here completely. This comes from a template, as you see. So if I click here, this one goes to that particular template that we have done the admission, which has structured information. And then once we finalize, let's say once we press this button, it goes to that uh, the progress note section that we have. So now, yeah, so that's how we have here. So let's go back to our progress note again, and then let's see whether we have covered the basic things. Yes, I think we have covered the basic things, but we have a few other things to discuss here, which I would like to do a different video around that. That's data from notes. Uh, that's actually data note, which has uh, sort of uh, a special kind of a note which captures information as well as creating a note itself, like for special kind of activities, like maybe a deteriorating patient, maybe a febrile episode, maybe sort of a special kind of word round. It has structured like templates to collect data. And the other one I'm going to discuss here, how to generate your templates. So how to create your own templates. So it's very easy. Then you can keep your template yourself, as well as you can make it public if others want the same template. Thank you very much.